Hello everyone, Dr. Charlie Johnson, physical therapist at Physical Therapy in Johnson, and today I want to have a shout out or make a shout out to all runners, okay? So I'm going to talk briefly about 4 common running form, not mistakes, but happenings, I guess, that cause aches or pains when people run, okay? And they're common things that we see every day when working with runners, okay? So again, there's really no perfect way to run. We see some really great runners who run kind of weird or cattywampus. They have some funky stride or something like that. Yeah, I said cattywampus, okay? Look that one up. But really, here are some of the common sort of flaws or things that we see happen that can sometimes put extra stress on tissues as people run, okay? So the first one is overstriding. So what we'll see is actually if we were to film a video of, let's just say, you running from the side, a lot of times we'll see that the person strikes almost like with their heel, but sort of in front of their body. So if you think about it, when you're running, you're going this way, right? You're not trying to slow yourself down. So if you strike actually in front of yourself, you're actually sort of impeding your progress, and you're increasing the force that the road or surface, whatever you're running on, exerts up through the lower leg, okay? So you increase the force through the legs by overstriding, okay? The next type of thing that we see is like a crossover or a scissoring kind of effect when you're running. So if we were to film you from behind running on a treadmill on the road, and there was to be a big piece of tape on the treadmill or a line on the road, we would actually see that as you run, you kind of cross over. So you hit that line every time or actually pass over it. All right, so the foot's kind of coming out and landing on in. And sometimes this can cause things like posterior tibialis tendinopathy, or a problem with the posterior tibialis muscle on the inside of the ankle there. It can cause some nerve problems on the inside of the ankle or on the outside of the leg. It can cause like IT band problems and or even inner knee pain, okay? So a lot of different things can happen there, hip problems as well, just from kind of crossing over. It stretches and puts excessive stress on some of the structures on the outside of the leg and often the inside of the foot, okay? The third thing is an upright trunk. So again, not really that big of a deal, but we have seen that if you just tilt your trunk forward 7 to 10 degrees, so that's barely anything at all, just a little bit, it can actually improve how your hips and some of the muscles in your legs function, okay? So again, in order to kind of cue yourself to do that, rather than running and trying to run like pointed forward, just run as if you're running into like a stiff breeze or a wind, right? You would just kind of lean forward a little bit. So that would be the way to try that out. And then probably the biggest error that we see is a really slow step rate or a slow cadence, okay? So basically what we would do is we would calculate how many steps per minute you were actually hitting the ground, and then we would come up with a number, right? So we see that a lot of times runners who have less than 160 kind of strikes per minute or steps per minute, they have more problems, all right? And really it's simple in that if you think about it, the more time you spend on the ground, so the slower you run, the more time you spend on the ground, the more stress and the more time that force from the ground has to exert on your tissues. So the more stress goes through your lower legs and up through the chain, okay? So if you increase your turnover, increase your step rate, then a lot of times you spend less time on the ground and you can have less discomfort, okay? So just a couple things that we see commonly. If you're a runner, if you're having aches or pains and you want to get back on the track, call us 484-552-3767. We'll check you out.